I have started the recording of this open meeting in compliance with CMS. For the record, prior to doing so, I announced that Palmetto GBA would make an audio recording of the open meeting and consented on behalf of Palmetto GBA. With that being said, let's go ahead and begin our presentation. Thank you.
All right, well, thank you, everyone, and good morning, and thank you for having me. So I'm Todd Schlesinger. I'm a dermatologist and a Mohs surgeon practicing in South Carolina, and I'm grateful for the opportunity to be able to speak to you today about the role of image-guided superficial radiation therapy in the management of non-melanoma skin cancer. Today, I'm going to frame my discussion around a January 2025 expert consensus manuscript that was published in Skin, which is the Journal of Cutaneous Medicine, that concluded that IGSRT, or image-guided superficial radiation therapy, is a safe and effective treatment for non-melanoma skin cancer that often results in highly favorable cosmetic outcome with a high cure rate. So just a little bit of background, this manuscript was executed by a panel of dermatologists with expertise in treating non-melanoma skin cancer with the goal of developing expert consensus recommendations based on a comprehensive literature review. And this is part of many recent articles that you probably heard about on this technology. So in this article, the methodology involves a comprehensive literature search with articles that were screened for relevance on the topic of treating non-melanoma skin cancer with IGSRT. And the articles were assigned a level of evidence based on the strength of recommendations, taxonomy, or sort criteria. The panel then created and voted on a set of consensus statements that were related to the treatment of non-melanoma skin cancer with IGSRT using a modified Delphi process. So in that process, subsequent rounds of voting lead to statements that everyone can agree on, for which there's consensus if possible. Of the 10 statements created, 8 received a unanimous vote and 2 received 5 out of 6 votes for adoption. So 8 statements received a strength of recommendation of A, while 2 were given a B based on the underlying quality of the evidence. And I'm just going to highlight a few of those statements here, not all of them. So the first one was that SRT is a well-established modality for the treatment of non-melanoma skin cancer, dependent on the individual patient characteristics. So IGSRT adds ultrasound visualization that can help evaluate the depth and breadth of the tumor. So this statement was based on the length of time that SRT has been utilized to treat non-melanoma skin cancer. In fact, it's been over a century. Larger studies have revealed that of low rates of recurrence for both basal cell carcinoma, or BCC, and squamous cell carcinoma, or SCC, over 5 years, with Kaplan-Meier estimates as low as 4.2% recurrence rate for basal cell carcinoma and 5.8% for squamous cell carcinoma. So adding image guidance with ultrasound allows the visualization of the dimensions of the tumor, as well as its exact location within the surrounding tissue for precise treatment planning. Now, while protocols have been developed to guide clinicians in the performance of IGSRT, various clinicians may take different approaches. So the second statement is that IGSRT is a safe and effective treatment option for non-melanoma skin cancer. And this was based on several studies that demonstrate a high level of local control, with the majority of patients having low-grade toxicity based on the radiation treatment oncology group toxicity data that was available within the literature for review. So almost 95% of the lesions that were treated received RTOG guidelines, which is the radiation treatment oncology group toxicity guidelines, of grades of 1 or 2. Which also mean low or moderate local toxicity, to the site where the tumor is, and slightly surrounding it. While the recurrence rates were low, less than 1% over 70 weeks, it is still recognized that longer follow-up of at least 5 years is optimal for assessing recurrence rates. So further studies needed, and there's some other data as well beyond that. The third statement is that I'm going to talk about is that dermatologists are the most appropriate clinician to direct and administer SRT, including image-guided SRT. And this statement was based on the fact that dermatologists have been performing SRT since its inception and have a deep clinical and histologic understanding of non-melanoma skin cancer, being that we're trained on pathology and and clinical dermatology during residency. It's part and parcel of what we do. And there are typically the clinicians that make the initial diagnosis, so they're being seen in our clinics first. Because they know the various methods of treating non-melanoma skin cancer, they're best equipped to have a robust discussion on the risks and benefits of the various treatment modalities, including this one. Dermatologists are adept at assessing treatment efficacy and toxicity. Therefore, the panel concluded that dermatologists are the most appropriate clinician to administer these therapies. Additionally, all the studies discussed that document the efficacy of IGSRT were performed by dermatologists with additional team members as well. So the conclusion there was that IGSRT can safely be performed in the outpatient setting with a multidisciplinary team to support its delivery. And the next statement was that SRT, including IGSRT, can be considered as first-line treatment for non-melanoma skin cancer for appropriately selected patients. And that was based on studies that demonstrated that IGSRT outperforms Mohs surgery based on statistically significant 2-year recurrence probability, with some limitations based on the study design and populations and a short follow-up interval. The panel concluded that IGSRT was supported as a first-line therapy for non-melanoma skin cancer in properly selected cases. And of course, that takes place with a discussion with the patient in a shared decision-making model. The next to last one is that SRT, including IGSRT, may be the optimal treatment for certain patients dependent on individual patient factors, age, comorbidities, patient preferences, tumor location, and tumor histology, as well as other factors. And this statement was supported by a freedom from recurrence rate of greater than 99% over 4 to 6 years across all evaluated tumor stages in the studies that were reviewed. The panelists noted the importance of the 6-year follow-up data in some cases, and SRT may be optimal for patients that do not want to undergo surgery or have certain comorbidities that preclude them from having surgery. So one study, for example, showed that tumor histologic subtype did not affect the efficacy of IGSRT in almost 20,000 patients. It's always thought that certain subtypes of tumors can be higher risk, and in this case, that seemed to be more balanced out among the cases. We didn't see issues with advanced tumor types. The other thing is that male sex in the past has been associated with worse outcomes for non-melanoma skin cancer with traditional therapies. But the outcomes with the IGSRT studies, in one of the studies looked at the freedom from recurrence was stratified by patient characteristics and didn't show that difference. Finally, patients with non-melanoma skin cancer need to be offered all appropriate treatment options and should be a part of the decision-making process. I'd alluded to this earlier, but there are several ways to treat non-melanoma skin cancer like basal cell carcinoma and squamous cell carcinoma, each with its associated pros and cons. So it's important for patients to understand the risks and benefits of each option so they can make an informed decision. A systematic review found that most patients are interested in shared decision-making, or SDM, as it's referred to, conversations that address their individual concerns. The review also found that physicians who use a shared decision-making model had improved patient satisfaction. So patients can benefit from a thorough conversation of the different options so they can feel well-informed. So the conclusion to the review is that IGSRT is a safe and effective treatment for non-melanoma skin cancer and can be considered as a first-line treatment option for appropriately selected cases of non-melanoma skin cancer. Thank you for your attention today.
Thank you. Melissa, I believe this concludes our open meeting since this was the last of the presentations. All right. Well, thank you, everybody. Have a good day.